And welcome to Duke Spine Institute. We're streaming spine surgery live for your viewing pleasure on April 8, 2025. Our patient has had back surgery before, not by me, but by another surgeon, and you can kind of see it right there, right? Can you
Yes,
see
we
that,
can.
Henry? It looks like railroad tracks.
Yes, we do.
Unfortunately, he had some invasive surgery. And of course, he's still suffering with pain, so he's here. And we're going to get him fixed up. Now, he's got three things causing his back pain. One, he's got a herniated disc at L2-3, pinching the nerve on the right side, going down his leg. Two, he's got a torn piriformis muscle on the right. Three, he's got facet joint pain on both sides of the spine. So we're going to break his surgery up into three streams. We're going to start by fixing the L2-3 disc with the Duke laser disc repair. If you have questions, feel free to ask me. I will say for this patient, we have a movie that comes to mind. I can't tell you much detail why, but it's called Army of Thieves, and it's on Netflix. Go watch it. He is the main character. Little numbing. All right, we need right L2-3 Duke laser disc repair. If there are any questions, type them up. Henry will ask me, and I'll do my best to answer them for you. First, we're going to gain access to the L2-3 by going from the side. Shot. Perfect. That's about as perfect an entry point as we can get. Jordan, show us where 2-3 is and how we're going to get there. Shot. That's right. Shot. All right, so the 2-3 is directly in front of my needle. I'm going to have to come and go a little bit further to the side. Shot. All right, I have to get around that facet. Shot. I can feel it. It's big. Shot. We're making our way around. I got to do a little dance with my needle tip. The dance of the needle tip. Not enough. The spine is not convinced to let the needle tip pass. Shot. So I have to reimagine my little dance. Still no luck. Let's get an AP. I can see the transverse processes. The facets are enlarged. All right. Well, that's not too bad. It looks like I might be hitting the top of the transverse process there. You guys see that?
Yes, we do.
I may have to go a little higher on my entry point just to get around it. On the lateral view, you can't really see that, but maybe that's what's happening. Yeah, there, I'm hitting it there. There we go, around it. I'm slipping past it. Let's hope I can do this. Shot, there it goes. All right. I'm reimagining the spine so that my needle and the spine come together harmoniously in a way that I can fix this man's problem. You like that, Berndes? 5, 4, 3, 2. 5, 4, 3, 2. So we are at 2-3, right side. Everyone agree? And we're doing the right surgery here? Yep. Okay. I'm happy with that. So let's get into this disc. Shot. And let's fix this gentleman's spine. Any questions, Henry?
Yes, we have a question coming from B. Moore on YouTube.
I don't need him awake. Go ahead.
Asking, I had a spinal fusion from the L4 to the S1 because of a herniated disc, crushing spinal cord, and numbness in the legs. This happened in February. Is there anything I can do myself to help recover?
Well, great question. I think you said L2 to L4.
L4 to S1.
Sorry, L4 to S1. There is no spinal cord at L4, L5, S1. So the area you had your surgery doesn't have a spinal cord. I'm not sure what was being crushed. It was probably the nerve roots. And to answer your question, num. Oh, all right, fine. To answer your question, I don't know enough about your situation to properly answer. But here's the thing. There's a very high likelihood that if you're not fully recovered, that there's something wrong with the treatment you had. That's just a statement I'm going to make based on many years of experience treating people like you with pinched nerves from L4 to S1. I believe if you're still having problems, your surgeon did not do the surgery properly. So I would like an opportunity to look at your new MRI now and to talk to you and figure out what's wrong, but also how we can fix it. I would say there's at least an 80% chance that I can fix you so that you're much better than you are right now with a minor procedure. I just don't know that for fact until I've had a chance to look at your MRI and to talk to you and do a quick examination. So go to our website, dukespine.com, fill out the form for the free MRI review, and get your free MRI with me. That's the best advice I can give you. If you're asking me, Dr. Duke, what kind of therapy can I do to get better? I'm not going to advise you to do therapy because, first of all, therapy is wonderful if you've addressed the surgical problem, which I don't believe you have. I believe you still have a surgical problem. That's just based on many years of treating people like you that have been treated elsewhere, and I've seen horrible surgery results from the surgeons and their patients, and I believe there's something that your surgeon hasn't done properly, and I can fix it most likely. I just don't know what it is yet. If I had to make a guess, I would guess you still have pinched nerves. I would guess that the surgeon hasn't treated everything that's wrong, and I would guess that you have a fixable problem, okay? And just telling you to go to physical therapy or use weights or pool or exercise, that would be irresponsible of me as a doctor to make a recommendation about a treatment that is not surgical when you may need surgery to fix your problem. So I need to know you better and what your issues are before I can make that kind of recommendation. All right? I hope you understand. I'm not trying to just get out of helping you. I'm trying to help you properly. And that requires a physical examination, and it requires me critically assessing your MRI to see what's there and what's been treated and what hasn't been treated. I hope you understand. All right, we are entering right L2-3. I'm kind of like a safe cracker. You guys know what a safe cracker is? Safe cracker gets into places that very few people can get into, right? So I just cracked into his L2-3 disc, and now I'm going to go in there and fix things for him to make him happier and better and have a better life. That's what I'm here for. Instead of the safe cracker, I'll be the spine cracker. All right, you can call me the spine cracker. Or you just call me a cracker. Right? Most people in the South were called crackers. Why does the suction look like it's not on? There it is. All right. Alrighty then. Any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is a herniated disc causes back pain and how it is that we cure it.
Before you do that,
Yes.
let's start from the very beginning. What are the most common causes of back pain?
Of course.
I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. All right, welcome back. We were just talking about some of the problems that people have getting medications these days. And you guys have just watched our video on the 30 most common causes of back pain. And those causes that we mentioned in our video account for 99.9% of all chronic back pain. All chronic back pain. So it's a very comprehensive list. It covers every diagnosis there is. And the truth is, we talk about this a lot, the most common cause for back pain is a disc injury called a herniated disc, but it has other names you've all heard, like bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, extruded disc. So all those different names are basically the same thing. It's a tear in the back of the disc where some of the jelly from the middle of the disc is coming out of the tear and forms what's called a herniation or bulge, or technically in medicine we call it a tumor, which is a small enlargement of tissue that shouldn't be there. So this bulging disc or tumor presses on the nerves right behind the disc, and that can cause leg symptoms like weakness in the legs, numbness, or tingling. But pressing on the nerves does not cause back pain, ever. Back pain or neck pain. The cause of back pain is not pressure on the nerve. It actually comes from inflammation. Instead of pressure, it's inflammatory, which is a chemical process. So think about it as like bleach. Does everybody know what bleach is, or Clorox? Where the bleach is burning your skin, even though you can't see it. It's not putting pressure on you, it's burning you. And that's what inflammation does. It burns like Clorox bleach, but it burns whatever's near the area of inflammation. In the case of your disc, it's going to be the small nerve fibers that are located inside the annulus. Those have a name. And the name for those nerve fibers is the sinovertebral nerve. Sinovertebral nerve. And those sinovertebral nerve fibers, which by the way are right here where I'm removing all this herniation at L2-3 on the right side, those little nerve fibers of the sinovertebral nerve are responsible for back pain. That's where we get back pain. Now, do other doctors know this? Unfortunately not. They don't. It's something that mostly I've discovered over time in treating patients with back pain and studying anatomy, neuroanatomy, and making sense of it. Making sense of it because nobody else has ever made sense of back pain. If you talk to most doctors, they tell you back pain doesn't have a specific cause. That's what they believe to be true, but it's not true. The video you just watched shows you the causes. Unfortunately, those doctors haven't watched the video yet. And they probably never will. Because most doctors get in the habit of just going to work every day and doing the same thing they were taught to do from their residencies, okay? Residency is where we go to learn our trade, where we go to learn to be a neurosurgeon. As a neurosurgeon, we spent 7 years. That's 7 years after medical school. So medical school is 4 years, and then we spent 7 years every single day practicing a neurosurgery trade. Learning how to do surgery, learning when to do surgery, learning how to recognize complications of surgery, learning the natural history of diseases. And during that time, we're supposed to learn something about back pain, but we never do. And so pain management doctors don't understand it any better. They understand a little bit better than the surgeons, but not much. So when surgeons have patients with back pain, they usually tell the patient, go see the pain management doctor or go to physical therapy. The problem is the pain management doctor, the physical therapist, the chiropractor, those kind of doctors cannot cure back pain because they don't have the skill set needed to do that. Okay? The skill set needed to do a cure of back pain is a surgical skill set. You must be a surgeon. You must do surgery. There is no non-surgical cure to back pain unless you have muscle pain, in which case muscle pain requires therapy and rehabilitation of the muscles. So the only back pain cause that's not a chronic back pain cause, by the way, is muscle that doesn't require surgery. Muscle pain does not require surgery unless it's the piriformis muscle, in which case it does. So unfortunately, the doctors that are relegated to treating back pain are not capable of curing it because they don't have the cure in their system. Look at the inflammatory tissue right there at 12 o'clock. You guys see it?
Yes,
it's
we do.
amazing. That's the source of his back pain right there. The pain coming from the disc. That right there, and now it's gone. We're zapping it away with the laser. That is the way to get rid of it. The best way to get rid of it. Now notice that you wouldn't be able to see that unless you had a scope, right? Unless we had a tube with a camera and a light source. So it's just like a safe cracker. Safe crackers, they can't crack those safes unless they drill a hole and put a scope into the safe hole, into the hole they drill, the bore hole. They have to create a bore or hole in the safe. Then they put a scope down so they can see what they're doing in there, and then they basically operate on the safe in order to crack it. Me, the spine cracker, I got to do the same thing. I got to put a scope in, a little hole, a scope. Now, safes don't bleed, but people do, right? Spines bleed. So we have to control the bleeding as a surgeon, whereas a safe cracker, they have to control oil and metal filings, which are small pieces of metal that come from all the drilling, okay? So it's very similar to cracking a safe, doing the surgery that I do. I use a scope with a light source, and I use a laser instead of a drill, but it does the same thing. It removes tissue that I don't want, and it's therapeutic. So in cracking a safe, you're removing metal from the safe that you don't want to be there so you can crack it. You got to remove metal. So that's why you get a drill and you drill. You use a drill to remove metal. You use a drill to gain access to the innards of the safe, and you use the drill to remove the parts of metal holding the safe closed. Okay? Why are we talking about safe cracking? Because that seems to be the topic du jour. It's kind of cool, sexy, interesting, and they made a movie about it. It's called Army of Thieves.
We have a question
Sure.
coming from Henmeister on YouTube.
Henmeister!
I love it because he says, "Hello, my name is Henry, and I'm from Australia."
Oh, Henry from Australia.
Love the name. I have scoliosis, and my T4 to T9 is 27 degrees curved, and my T9 to L2 is 45 degrees.
Yeah,
Would
that's
you
pretty bad.
Would you say these curvatures are easy to operate on?
Well, Penmeister Henry, no, they are not easy to operate on by any means. A 40-degree curve is pretty bad. Is it operable? Yes. But here's the thing. Do you need surgery? That's the real question. Okay? So my question to you is, why would you consider operation? What is your goal? That's really the question that every patient has to ask. What is my goal? If your goal is to get rid of your back pain, it can be done without surgery at Duke Spine. We have the technology to go in and eliminate your back pain without doing corrective surgery for your scoliosis. So what that means is you can avoid major surgery and still get rid of your back pain. Now, why would you ever want to do that? Look at that scar tissue right there. That's pretty cool. That's where all of his pain's coming from right there. I just annihilated it. You see that? He's got degenerative disc disease, really bad. He's got some scoliosis, not as bad as yours, Henry. But the whole source of pain is right there. It's 1 millimeter. So you don't need scoliosis surgery to get rid of the pain. You just have to come to Florida, to Duke Spine Institute, and let me get rid of the pain for you. And I can do it without correcting your curves. Okay? But some people say, Dr. Duke, I just want to correct my curves. Fine, I can do it for you. I do it outpatient, by the way. You go home the same day. Now, the T4 to thoracolumbar junction, that's a pretty big surgery. If you do it in Australia, you'll be in the hospital for sure, and you may never get out of the hospital, to be honest. Surgery like that has a high chance of dying, high chance of complications. I've got 3 minutes left on this disc, but if you come to Duke Spine, I can do it for you so you can get it done outpatient. Thanks, Sam. Way to stay on top of it. Oh, I thought it was Sam. I'm sorry. I didn't even look. I just saw you over there in the corner of my eye.
We have another question.
So to summarize Henry's question answer, correcting those curves is not easy by any means for any doctor, but at Duke Spine we can do it outpatient. So you can go home the same day. And I've done about 600 surgeries where I've corrected people's curves in the lumbar spine typically, not the thoracic, but we also do thoracic and we could do yours. But before you go having curve correcting major surgery that could put your life at risk, first see if you even need it. Do our free MRI review with me on Zoom, and let's figure out what's actually causing your back pain. All right? Grab her. Just about done with this disc. Now, I'm in what's called the lateral recess here, and for those of you who are anatomy buffs out there, this is actually a very interesting situation, because if you look at the MRI at L2-3, there's narrowing of the lateral recess, not just by the herniated disc, but also by ligament that is buckling, thickened ligament, and that's what we're seeing. And I just removed some of that. That's the thick ligament right there. See it at 12 o'clock?
Yes, we do.
Okay, and there's facet joint right there. See the facet, that brown? So I'm burning and destroying and removing the ligament that's anterior and medial to the facet. And I've got as much as I can through this approach. There's one last piece of herniation. I'm going to get that out, and we're done with this disc. So any other questions? Ask them now. Otherwise, we'll be back in 5 minutes with our Duke plasma rhizotomy for facet joint pain.
Just one question coming from Steven on YouTube asking, do you know one? I need a safe cracker, and also great camera work.
Oh, thank you. Thank you. Yes, I know a safe cracker. I'll let him know, but he doesn't work freelance anymore. And I can't really say anything more. But just think, I think he works for the people who don't want their safes cracked. He's on the right side of the law, let's put it that way. When you get to a certain level of safe cracking, and of course the same applies to, these are to people who break in online, hackers, right? Hackers. When you get to be the top of the game, then the good guys want you to help protect their interests against the bad guys. And so that's when it's really nice, because you can work for the good guys and do even better than we used to work doing bad things. So, all right, 7mm incision, just a 1/4 inch. I'm putting a couple of staples in, and we lost 5 drops of blood. So we'll be back shortly. We're going to do the facets next, okay?